What up, peeps? All right, so I'm just doing a mini presentation here today. I didn't get to do this cervical cancer presentation that I have been preparing for about a week now. So I am going to chunk it up and give it to you, and then we'll have a full recording later. But this small chunk is one of my favorite sections of the presentation, and it is on early stage cervical cancer. This is a fertility sparing case, but it still is a wonderful explanation of why we do what we do in gynonc. So your first case is a 31-year-old. She had a cone. She's diagnosed with squamous cell carcinoma and desires future fertility. And actually, it's not one patient, but it's 3 patients. So we have 3 different pathologies here. One, the cancer is to a depth of 2 millimeters and has positive LVSI. The second one is a tumor size of 1 centimeter to a depth of 4 millimeters, negative LVSI. And then the last one is to a depth of 4 millimeters and the tumor size is 1 centimeter with positive LVSI. So then I'm going to ask what stage is each of these patients and the next steps. So pause it now, try to figure it out, then we'll go to the next slide. All right, so I'm guessing you were right. This first patient is stage 1A and has positive LVSI. That's important. We'll go over that. Second patient, 1B1. Third, 1A2, positive LVSI. And here's some schematics here of these stages. So just a quick anatomy overview of what the parametrium is. So if you're just starting out, you know the parametrium is probably some sort of imaginary structure when you think about it. But these 2 pictures are pretty good. The parametrium is the fibrous and fatty connective tissue that surrounds the cervix. It is, it contains the uterine artery. And this is a really nice picture here and here of the relation of the ureter to the parametria. So when we're coming in to do a radical hysterectomy, at least at my institution, when we're taking the uterine artery, we're kind of flipping this up and using it as a handle. Here's the uterine artery and vein here. We're coming under it, we're tying it off, and then we're using it as a handle, and we're lifting it up as we do this dissection here where the ureter comes in, or I guess here, and taking all of this tissue here as the parametrium. So try to keep that in mind. The parametrium in cervical cancer, obviously it's directly adjacent to it, so there is concern for spread by direct invasion there. And one more thing before we get into the actual management questions is LVSI, or lymphovascular space invasion. Why do we care about LVSI? It's in endometrial cancer, it's in cervical cancer. Why do we need to know about it? Why is it important? So LVSI is the presence of tumor cells within endothelial line channels outside of the main tumor. And you can see here, this is a really nice photo. No photo credit to me. This was off of the internet. You can see LVSI. There's some cohesive tumor cells within space surrounded by endothelial cells. And why do we care? Because LVSI is a high risk factor for regional lymph node mets. It's associated with local recurrence and potentially distant mets after treatment, especially in cervical cancer. And so we take LVSI into consideration when we are thinking about surgical management of these patients. If they have positive LVSI, we are automatically in our heads thinking these people are higher risk, they need more investigation, and we need to have a higher suspicion for possible lymph node spread. That leads us to our management here. So stage 1A1, okay, none of our patients were stage 1A1 with no LVSI, but we'll just go over that here. Stage 1A1 with no lymphovascular space invasion for fertility sparing management, which we have here, and this is from the NCCN guidelines, is a cone biopsy with negative margins. Now, you might be wondering, why can it just be a cone biopsy? This patient has cervical cancer. I'm used to thinking about radical hysterectomies in these patients and doing lymph nodes, and this patient is just getting away with a cone biopsy. And that is because their risk of lymph node mets is less than 1%, and their risk of parametrial involvement from the data that we have is negligible. So we do not need to do a radical hysterectomy, which which essentially means that we are doing a larger dissection and taking the parametrium because that risk is negligible and they have less than 1% risk of lymph node mets, so you don't have to sample lymph nodes. But then we just talked about LVSI, so let's go down to stage 1A1 to 1A2 with LVSI. So you're thinking, well, geez, they only just have LVSI. Why do they need a different type of surgery? Why can't they just get a cone? LVSI has up to 9% risk of lymph node mets. It adds a fair amount of risk to lymph node mets. Now here, based on the data that we have, still the risk of parametrial involvement is negligible, but it does change what you're going to be doing, and you must sample the lymph nodes. So you can have a cone biopsy and a pelvic lymphadenectomy and consider sentinel lymph nodes, which will be later on in a different lecture probably. Or a radical trachelectomy is still on the table. And so this would, in fact, sample the parametrium, and there are several newer studies or data that are kind of questioning the fact of, do we need to sample the parametrium or not? And that's not for this lecture. So then our next patient, she's in this category. She might have not had LVSI, but let's just say stage 1B1 with LVSI. These patients have a 15% risk of lymph node mets and up to a 6% risk of parametrial involvement. So they are definitely getting a radical surgery. If they're fertility sparing, they're getting radical trachelectomy, plus a lymph node dissection. Whether that be sentinels or a full lymph node dissection is up to your institution, and we could talk about that data at a later time. But I hope this explains why we do what we do in these early stage cancers, cervical cancer, and fertility sparing management. And we can go over non-fertility sparing surgery in the next lecture. Put your questions below or DM me. I hope that this helps.